And thank you. So welcome back, Oisín. And then I'd like to just introduce our other additions to the panel, which is Mr. Tom McKittrick. So Tom is head of customer success at Odyssey VC, and he has over 2 decades working in the life sciences industry. Having worked as a scientist in R&D, CSV engineering, and held numerous senior positions, Tom is now responsible for customer success at Odyssey, and has extensive experience in working with life science companies, helping them adopt digitally compliant solutions for today and into the future. So thank you and welcome, Tom. And I'd also like then to introduce Magdalena. Magdalena is a quality assurance and compliance lead at Odyssey. Magdalena is a pharmacist with over 7 years experience in the pharma industry in quality roles within laboratory, manufacturing, distribution, and pharmacovigilance in international environments. Her broad experience in GXP environments supports pharmaceutical clients in the building of quality and compliance processes that can deliver and answer industry required standards and regulations. So great to have you joining us, Magda, as well. So there was quite a few questions coming through there, so we'll get going on them, and I'll throw them out to the panel as we come across them. So here's a question for the panel. As someone who works in pharma IT, I'm never comfortable when a SaaS provider pitches a multi-tenant solution. Am I right to be uncomfortable? It's an interesting question.
I might put something in on that, Pauline. I think that it's a great question, right? And I think it's like what it's similar to the question that you asked me at the end of my session there. It's about understanding what the data flow of the solution that's been utilized, what's the actual impact on the data flow, what's the protection of the records. The fact that it's multi-tenanted isn't necessarily a problem as long as you have the ability to demonstrate that data is segregated, controlled, and secure. I think there's this legacy position in not just life sciences, but a lot of industries where the data is particularly important, that I have to control it all myself on my own servers, my own architecture. There's a lot you can do in terms of traceability, auditability, and data integrity management across the life cycle of any data that you use. So yes, you're right to question it. What I wouldn't say it necessarily makes me nervous. I'd be more concerned about your ability to make sure that you can meet, for example, backup and restore and disaster recovery requirements as a regulated activity, which Fionnan pointed to in his slides. The fact that you can reproduce records in human readable format on demand if it's part of a regulated record side of it. So the security of it has to be questioned, but I think that that's a technical deployment question, can be asked and covered as part of a service level agreement with a SaaS vendor. So I wouldn't be concerned about it, but yes, ask the question.
Okay. Great.
Yeah, Pauline, just even on that, I think that the greater risk is the underlying provider who's hosting it. You know, are you deciding to do multi-tenancy yourself, or are you actually going out to a third party? Because what you can control yourself, obviously, is the evidence-based pathway to deliver, as Oisín says, that technical solution against the regs. However, if it's a third party and you haven't done your due diligence there and you're not sure where the data is stored, et cetera, that's where the questions come in. And that's something we see on a regular basis when we're discussing with potential clients or SaaS companies, you know, what that's going to look like.
Okay, thanks, Tom. I put another question to the panel. It says, we are already providing on-premises software to life science customers. We're looking to transition to a SaaS offering. How will our activities and responsibilities change?
I might take that one if
no, you go for Philip.
Yeah, and it all depends how it was validated in the first place. So for example, some companies would have taken your software, they would have assessed you as a vendor, accepted you, but they may have, the life science company may have done the validation of the software internally once they took it inside their own I suppose sphere of validation, and used you as a vendor to assist in all of that, but essentially the validation was theirs. If you go as SaaS, they may decide to do something similar again, or they may try to, there's a big push now for life science companies to get the vendors to do as much as they can, and that's not about being lazy or anything like that. It's about having the vendors invested and involved in as part of the process as well, and they learn that, you know, hey, this is important to life sciences, important that we validate, important that we maintain for various reasons. So it all depends on how that was validated the first time, as well as how it's maintained as well. So it's critical in the maintenance phase. For example, once it was validated in the life science company, it fell into their change control management, their configuration management, kappa, deviation, etc. All those good practices were managed internally. If you want to go to SaaS, you need to demonstrate that you put those processes in place in the maintenance phase for sure, so that the life science company can depend on you as part of a trusted vendor to maintain the validated state. I don't know, Oisín, if you wanted to add to that. Or
yeah, so I think the question that you just asked, Pauline, is kind of following on from the previous one around multi-tenancy, because like that legacy position, and it's kind of what I was trying to cover in my first session here, is that there are macro drivers that are pushing software into the SaaS model as opposed to that traditional on-prem. So as a life sciences customer, you might say, oh, I want that SaaS option again, or that on-prem option again, but I've only got SaaS. I think there's a couple of things when you're used to delivering traditional on-prem software, exactly what Fionnan said. In terms of the deployment, a lot of the responsibility lay with your customer.
Yeah.
When you move to SaaS, because of the last question you asked, you need to consider the architecture of your application. And we are helping, you know, countless customers on this SaaS re-architecture side, where you need to be able to stand over data segregation, data integrity as a pure web-based SaaS tool or multi-tenanted tool. It's not a problem as long as you consider it in the architecture. And then from a quality and a procedures perspective is exactly what Fionnan said. When you take it on as SaaS, like this session has been about, you now are responsible for the delivery of the bulk of the compliance requirements around that. And again, you can, because of the way the regulations are, you can cover that as part of your best practices and how you've developed that software. So that's where the differentiation comes in.
Yeah, and there's a couple of different scenarios, Pauline. I mean, if it's a legacy system sitting there and it was installed on-prem, let's say 15 years ago, it's a wonderful opportunity to build in whatever the CSA guidelines, et cetera, you know, are asking for as part of your new model to deploy out to your customer base. So like that's a wonderful opportunity to do that. If it's a case that was only a recent installation and you know, you're focused on on-prem and you're cutting licenses and things like that, then you know there may be other question. And as Oisín says, it's a different type of pivot. Then you know it's slightly different in that way.
Yeah, great, Tom. Thanks. And maybe another question, maybe this goes towards Magda. Let's see, how critical is it to have a documented quality management system when working with life science customers?
Yeah, thank you, Pauline. Well, assessing the SaaS provider QMS, it's a key part of the regulated company software selection process. They will do due diligence of the QMS, the entire SaaS. So they will look for evidence that the SaaS company has a governance and supporting procedures and records to ensure that the software that is being developed, implemented and maintained for the life science company complies with the regulatory requirements too. This will allow to have transparency on an audit, because the SaaS company will demonstrate what they are capable of, which are the measurements they have for providing the software, and also they be aligned with the regulation of the market they want to deploy the product.
Great, thank you, Magda.
You're welcome.
Another question, a couple more minutes for a few more questions anyway. As a SaaS provider looking to service life science, should we pursue third-party governance certifications such as ISO 27001?
Yeah, well, this type of certification, as Fionnan said earlier, they will give a good assurance for the organization that the processes are and the product is substantially developed in the same way. It's consistent and it gives this good advantage that there is a process for defining KPIs and monitoring the risk when developing a product. So it is a benefit for this company to have these certifications, but also remember that it's important, as in the previous question, to have this, not only the certification, but also to have evidence to demonstrate that we are capable to comply with these standards.
Okay. Yeah.
But the answer to that, Pauline, is no, you shouldn't pursue it. But really what you should do is go and get it, go that step further and actually get the certification, because it does map very well to your customer.
Yeah.
We learned that a long time ago as well as an
Yeah.
organization. Getting these certs meant that you could talk directly with your customer, and it was a very comfortable conversation. So it's in everyone's interest, I think.
Yeah.
Yeah, and a common piece of advice I'm hearing throughout the presentations, throughout the discussion here, is really just the evidence and the demonstration. You know, a lot of people are doing a lot of good things, but you need to be able to show, you know, especially for audits, and give the transparency as to how you're doing it. That's an important point for regulation companies. Another sort of related question, so I'll give this one quickly and we'll go on and see what else is there. It says, we are a small growing SaaS company. Do we think we need to hire a dedicated regulatory expert for our team to handle the regulatory requirements? I suppose it's more about what they all need to be putting in place as a SaaS company.
I might mention something on that. So I think the particular requirements, if you're a small growing SaaS company, I think there's always competition for resources. There's competition for time, there's competition for finances. You're focused on getting a great product to market. I think, firstly, and we know this because that's a kind of a core business for us, the skills availability, in particular in Ireland at the minute, is a real challenge around those skill sets. So looking for a full-time resource, you're now competing with big pharma, life sciences, companies, multinationals. And I don't think it's necessarily a full-time role for you. I'd say the ideal thing is to look for opportunities to outsource or partners. There are companies, we do it from time to time, but there are companies who can assist you part-time on a roadmap. What I would say is, at some point, if you target life sciences, at some point you're going to need somebody who's responsible for this function, because and Magda could even maybe respond to this bit, but I think even from a supplier questionnaire, in a lot of cases, you're asked to identify the function that's responsible for maintaining quality. And if you tie that into Fionnan's updates on CSA and GAMP second edition, if you're referring now to a third party or an internal function that's part-time, you just need to be aware of the impact of that in your ability to respond to questionnaires and audits when somebody is there to audit your business and your processes and your policies and procedures. But should you hire somebody, you should always have somebody who's competent in the role. Absolutely. That's not just for quality and compliance, it's for any role. It's not just an add-on function, it's a right to do business in this market. So you need to have somebody who's competent in assigning it. But I would say, make a plan. If you can, look at staging it, in particular for your early days, and make sure that you account for it when you go to commercialize your product fully.
Yeah, and it's a business decision. You know, it is something that you could decide it's a core part of what you want. But the great thing is we live in a fast-paced, society now, business culture, where the moving parts are there. Why not buy a bit of compliance? Why not buy a result? Why not also have a competent in-house person in that area, which will allow you, make good decisions as a business, because there's so much to do in that area. But then, the clever companies will always have a bit of both, and they'll be able to look to another company like a third party, like an Odyssey or somebody else, as an extension of their team to get, whatever business challenges done in order for them to service their industry as best they can. So, it's really down to a business decision.
Yes. It's as Tom and Oisín said, it's how to define what's the business requirement and which is the scope of it.
Yeah, great. Well, we'll wrap up shortly. I'm just going to maybe, just because this question we definitely answered maybe during the presentations, but I'd like maybe a good one for summarizing things. It said, we had an opportunity with a pharma company, but we felt the requests were extreme around our development processes. That's interesting. How can you ensure we're better equipped to respond the next time? How can we ensure, I suppose, we're better equipped to respond the next time? who would like to take that question?
That's it.
People. So I'll say it again. So,
Well, say it again, yeah, please.
Yeah, we had an opportunity with a pharma company. We felt their requests were extreme around our development process. So how can we ensure we're better equipped to respond the next time? I guess the next time they have an opportunity like that.
Well, yeah, if they feel that the requests were extreme around their development, I presume you're talking about development of software system.
Yes.
Or something along those lines.
I'm
Yeah. Well, look, that goes back to, you know, what Oisín and Fionnan were both calling out, which is the critical thinking, perhaps around how did they do it in the beginning? You know, what were they actually focusing on? I mean, people should know what the end goal of whatever product they're producing for this industry is going to do. And they should know that, I suppose, with best practice intertwined and against the regs. I mean, that is just the goal. So I think traditionally a lot of software companies had a great idea, decided they would get it in there and then just maybe, you know, patch it up a little while it's in there or whatever. And that wasn't how they started out, but that's the way the industry looked back towards it from a regs perspective. Remember, regulations are not about just, you know, developing software. Regulations are about how did you develop your software, and, you know, what was your actual purpose, et cetera, and how did you test it, and all the usual bits that go with it. So I would say that we could be talking about a mismatch here, Pauline, or if there's somebody who's been in the industry 20 years went and said that, then we'd be saying, gosh, maybe the regs were tweaked a little, that the, you know, the end customer is now looking with a different view. But remember, data integrity wasn't done necessarily to the same level 10 years ago. The way that data integrity assessments are being done now, or audits are being carried out, there's a lot more deep diving and squirreling going on around what they're looking for and why, and it's starting to throw up new things. And we see that all the time. You know, even our own data integrity assessment will change from time to time to reflect, you know, best practice and what's being brought up in the industry. So it is possible that you know, can affect maybe even a current relationship.
Great, Tom. Thanks so much. I think there's one final question, I suppose, that we can answer as Odyssey, but it says, do Odyssey host third-party SaaS applications as well as ensure their compliance? But we're happy to talk to you about what Odyssey do, no problem, but maybe you can answer that question quickly, and maybe that person could get in touch with us anyway directly.
Yeah, so I'd say that, Pauline, absolutely we do, and please, whoever asked that question, get in touch, because it depends again on the use case. I think the core of this message for this webinar series and what we're talking about today is, I mean, we have an expertise in it, and this is why we're trying to facilitate the adoption of digital at a much faster pace in life sciences. But I think digital transformation, if you take it back to one of the earlier slides that I put up, there's a huge opportunity here for life sciences companies to innovate, to grow and deliver efficiency, and there's opportunities for SaaS companies to bring solutions in. That's a core part of our business, is helping life sciences companies adopt the right fit technologies, but critically, because there's a lot of SaaS companies haven't really thought about it too much, because like the last question, it may be an accidental life sciences customer opportunity as opposed to a primary target segment. And then all of a sudden it's like, oh my God, how do I meet these needs? So that's a key thing for us, is to help SaaS companies get to this particular market, get their good tools and solutions in front of these regulated customers who are looking to actually purchase these tools. That's our objective.
Yeah, and I think whoever sent that question, Pauline, we just get their address and send a gold medal out to them. That's the best question of the day. We love it.
Yeah,
for sure. I think that's a wrap, and for the whole session. Thank you so much to everybody on this panel who's contributed. I think there was great information. It's great to see the guidelines starting to come, you know, in tangent as well in this whole area. So finally, some of those drafts coming out and those updates to help really move this on and drive this forward for life science companies. So thank you very much to Oisín, Fionnan, Tom and Magda. Really appreciate it. The polls that we ran, we'll share those through our social media so people will get to see those later. And I suppose just to finally say, you know, look out for our fourth and final part of this whole series that will take place in December. And that webinar is going to focus on the agile development methodology that satisfies regulatory requirements. So that's it. Thank you so much for everybody for attending and for the panel. Thank you.
Thank you.
Thanks, everybody.
Bye-bye.
Thank you.
Thanks for joining us. Bye-bye.